to introduce all of our guest speakers today. Our moderator is Roxane Spitzer, PhD, RN, MBA, and FAAN, who has been the editor-in-chief of Nurse Leader magazine since its inception in 2003. We also have with us today Ellen Hargett. She's the Director of Quality and Process Improvement for DeKalb Quality Institute at DeKalb Regional Health System in Georgia. While Ellen understands the importance of quality from her role as a quality leader at a major healthcare organization, she also experienced it firsthand as a patient fighting for her life as a result of a hospital-acquired infection at her own facility, and will share her personal story with us today. We have Shawnna Cunning, RN, MSN, PhD, and FNP-C, Director of Nursing, and Martha Bouk, RN, BSN, CIC, and Infection Preventionist. So with that, please join me in welcoming all of our speakers, and I'll turn it over to Roxane.
What are the biggest challenges you face in your position in regard to preventing infection and infection control?
Well, we all know that infection prevention is based on hand hygiene. So this is really the most critical issue that we can have. It's also hard to prevent infections from other aspects, from the surgical site infection arena to the CAUTIs to the CLABSI, because of the additional mandatory reporting that is necessary there. So it takes away your time to actually be up on the units to do some of the teaching and the observations that you really need to do.
What do nurse managers and nurse executives, what role do they play in assuring this?
Well, it definitely should start from the top down. You should model the behavior you expect to see in other people, and also make the commitment to it, such as, we purchased the DebMed product, showing that we're very serious about this and we're willing to put our money where our mouth is and invest in products that will help them do their job better, or track that they're doing their job better, so that we can kind of put numbers to it and they can kind of see exactly what they are doing. And as the numbers started coming out with the reports from the hand hygiene machines after we installed them, or even during our trial, staff were shocked that they needed to do more per the formula. And then we did some process analysis and looked at how nurses are using the gel, and realizing really those 5 moments, they're not re-gelling or re-washing their hands as much as they could be. And it was a real eye-opener for them that they had to change their workflow and their process. And of course there was some angst around that they were a little irritated, and they're like, that's a lot of gelling, that's a lot of washing. So I think opening that dialogue is very important too, because they had concerns. And even I remember as a nurse too, I'd be going into an isolation room and I'd have my gown and my gloves on. I'm like, well, now I didn't gel, and I gotta take the gloves off, so I gotta go in the room, so I gotta gel, and then I gotta put the gloves back on again. So you have to really open the dialogue with them and let them look at their own processes and make suggestions and be a part of it. And I think then they'll embrace it a little more.
In 2007, was diagnosed with uterine cancer, and the first line of treatment and staging of that is a total abdominal hysterectomy, which I underwent. And I had an unfortunate surgical error that happened intraoperatively, where a section of my abdomen was denied of blood flow, and that was not validated during the surgery. And so once I was closed and went home, it took about 3.5 weeks for me to become septic because of a large necrotic mass inside my abdomen. I was admitted back into the hospital, and at that time was cultured very thoroughly and didn't have any resistant organisms, just normal stuff that grows in necrotic tissue. So I underwent multiple surgeries to remove that necrotic tissue, and ended up with a very large gaping abdominal wound, and began then treatment inpatient and out for that wound. It took about another 28 days for me to be readmitted to the hospital, this time septic with MRSA. It was clear that I received that infection during the time I was receiving care at my own organization. Again, the short story, and I speak a lot about this all over the country, the experience was, it cost me 8 months of recovery. Cancer certainly seemed like a non-issue, even though I had stage 2 cancer and had to complete treatment for that. But the thing that nearly cost me my life was receiving care at my own facility where I helped design the systems that failed me. And that was a very humbling and powerful experience because I got the very best of what my organization had to offer. And I almost died because of it.
I think a big part of it is scripting the message. You know, no one comes to work wanting to make a mistake, and stories are so powerful. Like her story is very powerful because it's very personal. You know, it shows the effects that hand washing can have when it seems like it's such an innocuous thing, but it's really so important. So we show the data trends. We've also come up with a program called Data Scene Investigators, where we have some nurses who have been chosen and they are now receiving training so that they learn to analyze data and then post it on their units and talk to their peers about it. So they're going to be showing some of that data and talking about it with their peers and really owning it on a peer-to-peer type of communication. So it's not always from me or the managers. Because as a director, sometimes you feel like you're always harping at them. You should be doing this, you should be doing that. So I try to cleverly disguise my message in different ways so it's not that I'm always harping on them to do things. So I think using stories and other things like that are really good. And I also will tell the staff, you know, protect yourself. If you don't care about anybody else, I'm sure you care about yourself. You know, don't take germs home to your family.
The incidence of flu has been much less this year than last year overall. And that's national observations and data, so I think that helps too. But when you can help preserve yourself and keep yourself healthy, then they don't have to worry about the absenteeism and getting paid and using their earned time and things like that. So it's very important.
That in itself is a good return on investment. In the old days, when I was really practicing, in the olden days, you went in the room, you washed your hand, you left the room, you washed your hand. And now there are these 5 steps. Do you find that that has been more effective?
We had the process of the gel in, gel out. That's back when it was gel, not foam, you know, so that has changed too. But that was our basic comment. You gel in, you gel out. Now last year, going along with the trial and stuff, I changed the hand hygiene policy and I updated to the WHO 5 moments. We'd had knowledge of the WHO 5 moments before, but had never really zoned into it and made it something that was in the staff nurse's mind. So now the policy has changed and there's posters out everywhere, and we talk about that, about the other opportunities that could have prevented someone's infection on down the road. When you just go into a room, now you have computers, you have phones, you have your ink pens, all of the things in your pockets, and those are all opportunities to spread infection if you don't gel or use the hand hygiene again before you actually touch the patient. We don't really do individual monitoring at this time, and that's one of the benefits of this program, because if you want to do individual monitoring, you have name badges, and those are extremely cost ineffective at this time with all the reimbursement issues and everything else that hospitals are being hit with.
If we can all feel the same way about a lack of hand hygiene that we feel about messing up somebody and giving somebody an incorrect medicine, it's the same issue in terms of the impact to the well-being and the trust that that person's given us. So if that's one simple nugget that we can all remember one feeling and learn how to apply it to our everyday practice.